briefly, I'll be talking about, the geriatric oncology and from where it started and where is it now. And after that, we will proceed to our session. So a lot of people over here would be already knowing that the population is aging, and over next 20 to 30 years, the population is going to increase by, 1.5 billion people are there. This is world population, and it is only going to increase further in the next 30 years. As well as the older population also is going to increase. Along with that, the incidence of cancer is also going to increase over a period of time. So these are the stats. So in this, there's obviously a very, India is witnessing a demographic shift. So these are the estimates in which we can see that the cancer diagnosis, it is going to increase from 1.39 million, which was there in 2020, to 1.57 million by 2050. And in our hospital, around 34.2% of the total number of patients who are registered, they are above the age of 60 years of age. So that is a huge proportion of the patients who are coming to the hospital itself in the Indian setting in Tata Hospital. So this is another graph which is showing how the population is going to increase by 2030, and as well as the incidence of cancer, which is also going to increase, and that also in the older age group. So geriatric oncology is at its infancy as of now in India, and the majority of the older Indian patients with cancer, they are not evaluated systematically with a validated geriatric assessment, but they are rather assessed using a clinical judgment. So that is the whole point of this workshop today, to sensitize people on what is geriatric oncology and the importance of various assessments that needs to be done. And as you can see, this is the geriatrics, which is a major, core section, and oncology, which is another core part. And then you can see an intersection where that is the geriatric oncology part, where specific assessments are done for older people, and they are screened using various tools, and then all the toxicities are determined. This is the working of the geriatric oncology clinic in TMH. And as you can see, it is a multidisciplinary team, because that is very important for the management and for treatment of older patients especially. So we have our geriatricians who are part of the geriatric assessment. They also look at the chemotoxicity assessments are done, and various patients and caregivers' expectations and goals are seen, and a non-oncological life expectancy is seen. Quality of life is assessed, and there is also a joint clinic which we meet once a week, and usually it consists of physiotherapists, occupational therapists, pharmacists, and pharmacologists and oncologists. So this is our basic, our whole team. This is the proportion of cases that were seen in our clinic. So during the starting in 2018-19, the proportions were quite low, but as the awareness increased and the references increased, it gradually picked up. So now it is a clinic which is functional 6 days a week, and we are doing routine assessments, and all the referrals are coming from various other DMGs. So thank you so much for your patient hearing.